This patient had a disc prolapse at L4-5 level, more on the left side. Now before we start with the surgery, we identified the level with a image intensifier and a marker, and then after scrubbing the patient, we give an incision at the site that we bought before the surgery. The routine dissection is done with a monopolar cautery. This image intensifier identification of the level help us to minimize the incision. And can help us in the precision of the surgery as well. So once the correct level has been identified and opened, then we reconfirm the correct position, and after performing the L4, L5 hemilaminectomy or fenestration and removing the ligamentum flavum, we have arrived at the dura, and after identifying the exiting nerve root and retracting it medially, you can see that there is a disc prolapse at the index level. So we have to retract the dura to identify the prolapsed disc. Cottonoids are used and helping the retracting of the dura to avoid any dural tear. You can see that there is a ruptured disc component that can be visualized under the tip of the suction tube. Now once you have identified the prolapsed disc, you need to dissect it all the way around so that there are no adhesions and it can safely be removed without any damage. You need to be very sure where your exiting root is before you can retrieve the prolapsed disc, because this is the kind of damage you don't want to have. Now I am removing the disc in piecemeal. This is the ruptured component, so you have to remove it with the jerky movements. You don't have to pull it, and you can see now this bit of a bleeding that you can see is encountered because once the pressure is released, so the epidural vessel starts bleeding. You don't have to worry much about that. Now we have removed the disc, and you can see that this is the ruptured disc component that can be visualized. This is just to recap what we did before. So you need to dissect and retract the dura and the root medially and identify the prolapsed disc, and you need to be very careful and identify any bleeding epidural veins. For that you can use the cottonoids so that the hemostasis are secured and the field is clear and the structures can very well be identified. These are a few of the important steps that one needs to perform. A microscope can certainly help you a lot in this. If you're doing it without the help of a microscope or with a loop, so you would not have that kind of a magnification. Now you can see this is the finishing view, and it's a very small wound incision, probably 1.5 inch. Thank you so much.